Good morning, everyone. It's 10 o'clock. We will begin our webinar. Welcome to the New York State Care Management Training Initiative. My name is Ruth Cologne-Wagner, and I am the Senior Project Coordinator with NIAPRS. I'd like to introduce you all to Edie Schwartz. She is the Director of Systems Transformation with NIAPRS. Edie?
Thanks, Ruth. Good morning, everybody, and welcome. It's really nice to be able to welcome you at NIAPRS. Many of you were involved with our last New York State Care Management Training Initiative a couple of years ago, and we're very happy, thanks to a grant from the New York State Department of Health, to be offering you this, this additional project for the next year and a half. And so very happy to have you. I think you'll learn a lot of information today. We're very pleased to introduce you to our partners today, and I think that we have really worked hard to meet your needs and be able to offer this training to you to help you to transition into the health, home, and managed care world. So I look forward to the journey with you, and again, thanks for giving us your time and your energy for this great training coming up. And at that, I'll just pass it back to Ruth, who will begin our presentation today.
Thank you so much, Edie. I'd like to give everyone an overview of who NIAPRS is and what we do. NIAPRS stands for the New York Association for Psychiatric Rehabilitation Services. If we can advance to the next slide, please. We were founded 34 years ago in 1981. We are a statewide member agency, a coalition of people who use and or provide community mental health services. NIAPRS is dedicated to improving services and social conditions for individuals with psychiatric conditions. Many of you may be familiar with our advocacy work, our educational forums, which include many conferences, webinars such as this, and other events throughout the state. Our collective staff, through our collective staff, we provide training and technical assistance to various provider organizations in New York as well as nationally. We provide employment campaigns and cultural competence initiatives as well as wonderful peer services. NIAPRS is very proud to have earned a second grant, just like Edie said, from the Department of Health. It is called the Health Workforce Retraining Initiative. This is our second phase of this initiative. In phase one, we trained over 700 care managers across New York State. This second phase is intended to strengthen and expand the care management workforce by providing needed skills and competencies to succeed. Now, NIAPRS is not doing this alone. We are very excited and pleased to be working with 4 partner organizations: the New York Care Coordination Program, the Center for Practice Innovations, the New York State Council for Community Behavioral Health Care, and Tech Leaders Consulting. I'd like to take this opportunity to introduce to you representatives of each organization so that they can provide you with an overview of who they are. First, I'd like to introduce Adele Gorgeous, the Executive Director of the New York Care Coordination Program. Adele?
Good morning. The New York Care Coordination Program is a multi-county, multi-stakeholder collaborative that was put together to improve health care and life outcomes for individuals with serious chronic health issues. Critical to this work has been developing training for a care management practice that is person-centered, recovery-focused, integrated, and culturally informed. The approach, which we have been working on over a number of years now, has yielded measurable results. It informs the work and training of the 22-county health home, Honey, that New York Care Coordination Program manages, and it is informing the work we're doing with NIAPRS for this care management training initiative.
Thank you, Adele. Next, I'd like to introduce to you Paul Margulies. He is the Associate Director of Practice Innovation and Implementation with the Center for Practice Innovation. Paul?
Thank you, Ruth, and good morning, everybody. As many of you know, the Center for Practice Innovations is funded largely by the Office of Mental Health to bring evidence-based practices to agencies and programs across New York State. And we work literally from Buffalo to Long Island and everywhere in between. So CPI supports the OMH mission to promote widespread availability of evidence-based practices that will improve behavioral health services, ensure accountability, and promote recovery-oriented outcomes for consumers and families. As you can see here, there are 3 primary goals. The first is to promote the widespread availability of these evidence-based practices across New York State. The second is to promote innovations related to these emerging promising practices and cultural adaptations and organizational change approaches that support the implementation of quality services for individuals with serious behavioral health problems. And finally, we create informational and educational resources for the general public, as well as users and providers of behavioral health services. And I should emphasize that, much of our work, although not all of it, is through the use of online modules. At this point, we've developed and made available over 50 of these to date. We also do webinars, we provide online meetings, and especially put a lot of emphasis on learning collaboratives where participants learn from each other as well as from experts.
Thank you so much, Paul. Next, I'd like to introduce everyone to Marnie Ehrlich. He is the Senior Partner with Tech Leaders Consulting.
Good morning, Ruth. Thanks for that introduction. I'm Marnie Ehrlich. We have a company that is a full-service grant management and meaningful use provider for the program. Our role here is predominantly to assist the organizations in meeting the needs of this particular grant and complying with it. But we have a secondary role which we play for New York State. We actually are a New York State eHealth collaborative agent and are specifically focused on helping organizations, behavioral health organizations particularly, meet the goals that the state has for health information technology, which are, there's a program called Meaningful Use, which pays out to particular agencies funding for meeting that, but also there's another initiative specifically for care management systems. So we play a role in helping any of the organizations that may have questions about what IT support services are available from New York State and how you can access those funding sources and so on. So, we've been heavily involved with the behavioral health world from the start. We founded the Behavioral Health Informatics Conference in New York, and we continue to participate in that. So that's what we're doing for the program.
Marnie, thank you so much. Next, I'd like to introduce everyone to Cindy Levinoy. She is the Director of Communication and Member Services with the New York State Council for Community Behavioral Health Care. Cindy?
Thank you, Ruth. Good morning, everyone. The New York State Council is a statewide nonprofit membership association, and we represent nearly 100 behavioral health, both mental health and substance abuse providers that offer both prevention, treatment, and recovery. These are organizations that are across the entire state. Our members include freestanding community-based agencies, general hospitals, and counties that operate direct services, and we offer our members advocacy services, education, information. We're really pleased to be part of this project, and we thank NIABRS for asking us to join as a partner, and we welcome all of you to this project and think that we're going to have a great opportunity for learning over the next 15 months.
Cindy, thank you so much. I'd like to take this opportunity to clarify the sign-up process. A lot of you have phoned me or emailed me, and so I just think this is a good opportunity to share with everyone. All supervisors have already signed up using the online Adobe application, and that was back in November or December. That information was then used to create for you an account within the learning management system created by the Center for Practice Innovations. Now, the LMS is where all of our online learning will take place. An email informing you of this went out last Friday to all supervisors that you have been signed up. Now, the next step is for each care manager to sign up. By the end of this week, we'll be sending each supervisor an email to forward to your care management staff, and they will have instructions on creating their own LMS account. I hope that clears everything up for folks, and if it hasn't, please feel free to email me or call me anytime. Now, the Care Management Training Initiative consists of 2 tracks. One is for care managers, and the other is for supervisors. Now, regardless of what track you are in, you will have access to a lot of information. Phase 1 training webinars and its accompanying resources. Next slide, please. Now, however, you will have access to all of this information, but what is absolutely required for this Phase 2 are the 5 webinars that are being created for this training. The care management track is one of the most straightforward tracks. It consists of the 5 required training webinars. Now, our preference is that everyone watch the webinars live, as that will facilitate the learning process, as it also coincides with the supervisory track. However, we recognize that not everyone can watch every webinar live, so we will record them and archive each of them onto the LMS system. Now I'd like to bring back Paul Margulies of CPI to discuss the supervisory track.
Hello again. So as you can see, we're going to be placing a lot of emphasis on working with supervisors as well as care managers. And for supervisors, there are a number of training events that we'll make available. First and foremost, of course, are the 5 training webinars that Ruth has already described. And beyond that, there'll be 3 in-person learning collaborative meetings, which will be done regionally, the first of which are scheduled for this coming week, actually next week. And we'll be in Batavia and in Syracuse and in Albany for those. And then there are these online learning collaborative meetings that focus on supervision of specific competencies. So each of the webinars focuses on competencies, and these are then followed up with online meetings with the supervisors. One set of these online meetings will be content reinforcement, and will focus on the supervisory skills that will be helpful in helping care managers to adopt these competencies. And then the second of these online learning collaborative meetings will be basically report back where supervisors will talk about the work they've been doing in supervision over the course of the past month or so. And we'll be able to talk about accomplishments as well as address challenges. Next slide, please. Okay, and this slide basically says a very important thing, and that is we can't do this without supervisors. You know, so much of the work involved will be direct supervision on-site of care managers, and we can't really do it without supervisors, which is why we're putting a lot of energy into our work with the supervisors. Next slide, please. And so here's the structure, and all of this occurs over the course of the 2-month period. So at the beginning of each 2-month period, and each topic is really addressed in the course of these 2 months, there's a webinar for care managers which focuses on a particular competency, and you'll learn about these competencies in another moment or so. We start with a webinar for care managers. That's followed in that very same month with a learning collaborative statewide meeting for all supervisors, and the focus is on supervision of these specific competencies. And if you will, this is kind of a didactic presentation. We'll be talking about kind of how-tos. The following month, after supervisors have had an opportunity to do some of the supervision, we'll get back together again with the supervisors online, this time regionally. And here the focus is going to be on the supervision of the specific competencies with a discussion of experiences, review of accomplishments, and some problem solving around challenges. And that'll be repeated for each of these 5 topics.
Wonderful, Paul. Thank you so much. I'd like to introduce everyone to Christine Mangione. She's the Clinical Director for Health Homes of Upstate New York to discuss the webinars and the in-person learning.
Thank you, Ruth, and good morning, everyone. So over the next 15 months of this initiative, we will be offering the following webinars: outreach and engagement and retention. And included in this webinar will be an introduction to the patient activation measure and cultural activation prompts. The next webinar, Understanding Complex Needs, will be focusing on changing behaviors and helping individuals meet their healthcare goals. The third webinar, Navigating Complex Systems, will focus on managed care organization expectations for the health home care managers. The fourth, Effective Outcomes Measurement and Management, will, as the title implies, be focusing on outcomes and how to reach optimal outcomes with your clients. And the final webinar will be Workload Management and Using Technology to Enhance Productivity and Effectiveness. And in here, we're saying enhancing your toolbox for maximum effectiveness, and we'll be looking at some of the new tools out there that will help manage and support your efforts with the individuals you're serving. Next slide, please. These in-person sessions will be held in 3 regions. You've been allocated to a region based on the regions as designated by DOH, and then what we've done is we've further refined those regions into 3. And as Paul mentioned, the 3 regions are Region 1, Western, and Rochester. And for this particular region, Valerie Way will be the facilitator. Region 2 will include Central, Utica, and Watertown. Margie Meets will be the facilitator, and Region 3, Northeastern and Northern Metro, essentially Albany, and Cheryl Martin will be your facilitator.
Thank you so much, Christine. Paul Margulies of CPI, if you can return, please, to discuss the learning management system.
Hello again. You've heard already about our learning management system, and here is a snapshot of the landing page. So once you get into the learning management system, this is what you'll see initially. And from this page, you can access the required trainings as well as optional training resources, and these include Phase 1 webinars. There are also other recommended resources and also helpful links. And all of that you can reach through this landing page. In addition, as part of our training design, it's important for us to capture your level of comfort with important care management skills, and we need to do this pre- and post-training. So before you begin the webinars, we'd ask that you and your team complete this assessment on the LMS system, and here's kind of a snapshot of what it would look like.
Thank you, Paul. I'd like to bring back Cindy Levinoy of the New York State Council for Community Behavioral Healthcare to discuss outreach.
Hello again, everyone. So this project, as we've talked about, is for 15 months, and we want to ensure that the project is successful for each of you as well as your organization. And we also want to make sure the project is successful for this initiative overall, as it is a grant project from the Department of Health. So Ruth and I will be keeping in touch with all of you throughout the length of the project, and we'll be providing reminder calls to each of you just to make sure that you know about the upcoming webinars and to ensure that you're continued participation, both from a supervisory level and also from a care management level.
Thank you, Cindy. We are currently accepting individuals for our Care Management Training Initiative Steering Committee. Now, the Steering Committee, we plan on meeting monthly, and we're going to be reviewing the curriculum for continued relevance to the work that we do. We will evaluate the outcomes and discuss the impact of the training having on your organization and the work in general. Now, if you're interested, we'd love to have you, so please contact me, Ruth Cologne Wagner, at ruthcw@nyaprs.org. Now, most of our communication with you will continue to be via email. Now, these are email addresses that you see there. You may be receiving emails from any one of those addresses. Some people, some organizations have very strong email filtering systems, and we suggest that you allow access to these addresses so that you don't miss any of our communications. We've already had individuals find out that our emails, some of our emails have gone straight into the spam folder, especially if it's coming from WebEx directly. So please make sure that you open access to these. Before we complete for today, we also wanted to just let you know, I want you all to feel free to call me and email me as you have already been doing. Please feel free to do that continually throughout our 15 months together. So we know this has been a very quick presentation. We hope that you found it informative and helpful as we move forward in this training. On behalf of everyone at NIAPRS and all of our partners, we thank you all for joining us today, and we look forward to the next 15 months together. Thank you.